Hey everyone, good to see you all. Glad to be back online. I know it has been some time, but I'm popping on today because I have had a request from actually several people in our community to chat a little bit about childbirth and pelvic pain or sexual pain that begins after having a baby. So today I'm going to take a few minutes to talk about that, and we'll start with vaginal deliveries first because I'd say the number one reason for pain with penetration or sexual pain after a vaginal delivery is because of perineal tearing. So in one of my previous videos I did speak about perineal pain and some of the reasons around why people experience perineal pain, so you can always look back on that video. But just as a quick review, if we look at this pelvis here, the perineum is this area right between the vaginal region and the anus, so right through all of here. Okay. Now, of course, there's fascia or connective tissue. There are muscles that attach to this area. Pelvic health practitioners often will call this area a grand central station for pain because there are so many structures that sort of cross over and go through this region. So that is the perineum. Now, with vaginal deliveries, if we look at the literature, about 85% of individuals that have had a vaginal delivery will experience some sort of micro tearing or trauma to the perineal region. Okay, now when we look at perineal tears, there are 4 grades of perineal tears. And so to put it simply, it goes from grade 1 to a grade 4. Now, grade 1 perineal tears are a pretty minor trauma to that area. So if we look at this region here, grade 1 perineal tear involves some of the skin and the fascia just at the back of the entry of the vagina or the introitus, okay? And that's pretty low level. That sort of tissue will heal on its own. It doesn't really require any huge intervention because it is very superficial to that skin. Okay, now when we're looking at a grade 2 perineal tear, that is involving some of the skin, but also a little bit more into the layers in the perineum or the muscle here. Okay, there are some circumstances that which require some stitching for grade 2 perineal tears. And it's interesting, I was just at a conference last week and there was a recent study done to show that postpartum, the highest rate of pain that persists up to 1 year postpartum, a lot of these individuals actually sustain grade 2 perineal tears. So even though it is a lower grade tear, it doesn't necessarily mean that it cannot contribute to pain in the postpartum, especially within that first year. Okay, so that is grade 2. Now, if we're talking about a grade 3 perineal tear, we're talking about a tear that then travels down through all of those other structures I spoke about and also involves this muscle here, and this is the external anal sphincter of the pelvic floor. So some of the tissue fibers through this sphincter muscle are also compromised. Again, higher grade. And then the last grade is grade 4. So it will involve the skin, some of the muscles around the perineum, the sphincter of the muscle, as well as some of the tissue or the mucosa within the canal of the rectum. Okay. So those are the types of tears for perineal tears, or the grades of tears. Now, it is important to note that with grade 3 and grade 4 perineal tears, one is much more susceptible to anal incontinence, meaning they may be more susceptible to not being able to control gas or flatus, as well as not being able to control feces. So really important to note, if we look at our medical guidelines, grade 3 and grade 4 tears, there should be some referral to a pelvic health physiotherapist or practitioner that can assist with this sort of healing and return to function. Okay, so there you have it. You have perineal tears of grade 1 to 4. Now, I've also had the question about C-section deliveries, and does that minimize or eliminate an individual's experience of pelvic or sexual pain? And the simple answer is not necessarily. What we're seeing with C-section deliveries is that even though the structures around the vaginal entry and around the perineum remain intact, the scar tissue through the C-section area, or that lower abdominal area, so we're talking about probably around here, right above that pubic bone, the scar that will form from that C-section incision can become very adhesed, very tight, and as a result, because there is a continuity of soft tissue from the tummy all the way down into this area, it can create a lot of restriction into the vaginal region as well. Okay, so when that fascia, when that connective tissue is tighter through the abdomen, it tugs from the bottom and creates a little bit more potential tension to the structures around the entry of the vagina. And that can, as a result, bring on pain with penetration, as well as pelvic pain in and around the vulva and around the C-section scar as well. Okay, so there are some reasons for pain after childbirth. If you have any questions at all, just let me know in the comments and I'll get back to you. All right, I'll see you soon.